Good afternoon. Today I wanted to talk to you a little bit about some of the newer techniques regarding elbow surgery. This here is a standard elbow model. As far as the older techniques regarding elbow procedures, particularly when it comes to contracture releases or even removing a loose fragment within the joint, it usually required an open release, such as a large incision on the lateral side of the elbow or the medial side of the elbow, such as on the inside of the elbow. Over the past 10 to 15 years, elbow arthroscopy has become the preferred method regarding treatment of contracture releases of the elbow or even removing loose fragments within the elbow. Elbow arthroscopy requires two small incisions less than a centimeter, one on the medial side, one on the lateral side of the elbow. We put a camera in about half the size of this pen within the joint and release some of the scar tissue in the front and manipulate the elbow to get your motion back. A contracture is where you do not have full range of motion of the elbow, and sometimes we have to make an additional incision posteriorly to remove some of the scar tissue in the back of the elbow to get the flexion back, and this will allow you to gain an acceptable arc of motion. Occasionally there will be bone spurs or even loose fragments in the front or in the back of the elbow that can be easily removed with an arthroscopic scope. The good news is that this is significantly less invasive than the previous procedures described, and the recovery is significantly faster. This is an area of expertise that we've been specifically trained on in arthroscopic and minimally invasive procedures. So if you do indeed have any locking, clicking, or pain within the elbow, particularly with any flexion or extension, or you notice a loss of motion of the elbow, I would suggest that you be evaluated by an orthopedic specialist, for particularly one that's specifically trained in elbow arthroscopy and minimally invasive procedures. Thank you.